you familiar with anxiety? Do you think anxiety is a normal in real life? If yes, you need to hear this. But if no, you also need to hear this. Hi, Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Khairina Syafiqah binti Khairil Azhar. So, today I want to share with you guys about anxiety disorder. Are you anxious? Maybe you are feeling worried about a problem in your class. Maybe you have butterflies in your stomach while waiting for a result of a medical test. Maybe you get nervous when driving home in rush hour traffic as cars speed by a wave between lanes. In life, everyone experiences anxiety from time to time. This includes both adults and children. For most people, feeling of anxiety comes and goes, only lasting a short time. Some moments of anxiety are more brief than others, lasting anywhere from a few minutes to a few days. But for some people, this feeling of anxiety are more than just facing worries or a stressful day at work. Your anxiety may not go away for many weeks, months or years. It can worsen over time, sometimes becoming so severe that it interferes with your daily life. When this happens, it's said that you have an anxiety disorder. Now, let's take a look what are the symptoms of anxiety. Why anxiety symptoms vary from person to person. In general, the body reacts in a very specific way to anxiety. When you feel anxious, your body goes on high alert, looking for possible danger or activating your fight or flight response. As a result, some common symptoms of anxiety include nervous, restless or being tense, feeling of danger, panic or dread, increase or having sweating, difficulty focusing or thinking clearly about anything other than the thing you are worried about, rapid breathing or hyperventilation, and insomnia. The first one is panic attacks. A panic attack is a sudden onset of fear or distress that peaks in minutes. There are some symptoms of anxiety that can happen in conditions other than anxiety disorder. This is usually the case with panic attacks. The panic attacks are similar to those of heart disease, thyroid problem, breathing disorder, and other illness of these symptoms. As a result, people with panic disorder may take frequent trips to emergency room or doctor office. They may believe they are experiencing life-threatening health condition other than anxiety. However, do you guys know what can cause of anxiety? Doctors don't completely understand what causes anxiety disorder. It's currently believed certain traumatic experience can trigger anxiety in people who are prone to it. Genetics may also play a role in anxiety. In some cases, anxiety may be caused by an underlying health issue and could be the first sign of physical rather than mental illness. The first one is trauma. Children who endure abuse or trauma witness traumatic events are at higher risk of developing an anxiety disorder at some points in life. Adults who experience a traumatic event also can develop anxiety disorder. Second, stress due to an illness. Having a health condition or serious illness can cause significant worry about issues such as your treatment and your future. Third, other mental health disorder. People with other mental health disorder such as depression often also have anxiety disorder. So, drug and alcohol use or misuse or withdrawal can cause or worsen anxiety. Last, having blood relatives with an anxiety disorder. Anxiety disorder can run in families. Last but not least, there's no way to predict or percent that will cause someone to develop an anxiety disorder. But you can take steps to reduce the impact of anxiety if you are anxious. The first one is get exercise. Setting up an exercise routine to follow most or all days of the week can help reduce your stress and anxiety. If you are normally sedentary, start off with just a few activities and continue adding more over time. And And then, stop smoking and reduce or stop consuming caffeine drink, nicotine and cigarettes, and caffeine beverages such as coffee, tea, and energy drinks can make anxiety worse. Moreover, get enough sleep. A lack of sleep can increase feeling of restlessness and anxiety. If you have trouble sleeping, see your doctor for a help. And last, stick to a healthy diet. Eat plenty of fruits, vegetables, whole grain, and lean protein such as chicken and fish. Do you know the prevention is better than cure, right? That's all from me, and thank you everyone. Bye bye.